7 out of 10 Americans will require long-term care at some point in their lives, according to federal health data. The national median cost of a nursing home in 2026 is $9,342 per month for a semi-private room. At that rate, $250,000 in retirement savings, what many Americans consider a meaningful nest egg, runs out in approximately 26 months. And that national average conceals state-by-state differences so large that the same savings lasts 6 months in one state and 4 years in another. Where you retire determines whether healthcare ends your financial security or simply reduces it. Subscribe now, because most retirement plans were not built to absorb what is actually coming. The inflation gap that is quietly destroying retirement plans. The most structurally damaging feature of healthcare costs in retirement is not their absolute size. It is their growth rate relative to every other retirement income source. HealthView Services, whose annual retirement healthcare cost reports are used by financial planners across the country, calculated in their February 2026 data report that Medicare Part B premiums grew by nearly 10% in 2026 alone, more than 3 times the rate of food inflation at 3.1%, energy inflation at 2.8%, and general consumer price inflation over the same period. The Social Security cost of living adjustment for the same year was 2.8%. Healthcare is growing at more than 3 times the rate of the income adjustment that most retirees depend on to keep pace with costs. The Employee Benefit Research Institute's 2026 retirement healthcare analysis, cited by Kiplinger, produced numbers that should recalibrate every retirement plan that treats healthcare as a fixed or predictable line item. To have a 90% chance of meeting their healthcare spending needs in retirement, a man needs $212,000 in dedicated savings, and a woman needs $252,000. A couple enrolled in a Medigap plan with average premiums needs $267,000 for a 50% chance of meeting their costs. Not a 90% chance, a 50% chance, meaning the projection is that roughly half of couples with that amount of savings will still run short. In extreme cases involving costly prescription drugs, EBRI projects couples may need up to $469,000. Milliman's 2025 Retiree Health Cost Index calculated that a healthy 65-year-old woman retiring will spend approximately $313,000 on healthcare over her lifetime, and a man approximately $275,000. Figures that assume original Medicare Part D prescription coverage and a Medigap Plan G supplement, and that do not include long-term care, which can add 6 figures on top. The pre-Medicare gap nobody plans for. The average American retirement age is 62, according to HealthView's 2026 data report. Medicare eligibility begins at 65. That 3-year gap, which affects millions of Americans who retire at the age the economy and their health are telling them to, but before the age, the government's healthcare system is ready to cover them, is one of the most financially dangerous periods in the entire retirement timeline. And it is most dangerous in the states where private insurance costs are highest. Vermont residents face average monthly silver plan premiums of $1,224 in 2026, according to Visual Capitalist's analysis of Value Penguin data, the highest of any state in the country. Vermonters spend 19.6% of their income on healthcare, more than double the United States average of 7.9%. The drivers are specific and documented: higher hospital costs, years of structural underfunding, and a high volume of emergency room visits resulting from a shortage of primary care alternatives. A 62-year-old retiree in Vermont with no employer coverage who has not yet qualified for Medicare is looking at $14,688 per year in health insurance premiums alone before a single claim is filed. Massachusetts carries the highest family health insurance premiums of any state in the country, according to the Massachusetts Health Policy Commission, with average annual family health costs exceeding $31,000, including out-of-pocket spending. The HPC specifically warned that affordability pressures are causing Massachusetts families to avoid needed care, a signal that the cost structure is already producing the rationing behavior that economists associate with healthcare systems under maximum financial stress. Alaska's marketplace plan prices rose more than 16% in each of 2023, 2024, and 2025, according to Alaska Beacon reporting, with an 18.4% jump in 2023 alone. New York's hospital spending has been rising twice as fast as wages and 5 times as fast as inflation over the past decade, according to Community Service Society research, pushing premiums and out-of-pocket costs higher across the state and making New York one of the most punishing environments in the country for a retiree without employer-sponsored coverage. What Medicare spending geography reveals. Medicare spending per beneficiary varies dramatically by state in ways that reveal something important about which states systematically produce higher healthcare costs for retirees, even after they are covered by federal insurance. Per beneficiary Medicare costs range from $8,726 in Vermont to $13,652 in Florida, according to CMS National Health Expenditure data, a difference of nearly $5,000 per Medicare recipient per year between the least and most expensive states in the system. Florida's position at the top of that ranking is counterintuitive given the state's marketing as a retirement destination, but it reflects a specific structural dynamic. The concentration of elderly patients in Florida's healthcare system, combined with the state's high rate of specialist utilization and the cost structure of its hospital networks, produces per beneficiary Medicare spending that is 56% higher than Vermont's for the same federal insurance program. That difference does not show up as a premium. Medicare premiums are national, but it shows up in out-of-pocket costs, supplemental insurance pricing, and the overall financial pressure that healthcare exerts on retirement budgets in high-utilization states. The enhanced ACA premium tax subsidies that had been reducing marketplace plan costs for millions of Americans since 2021 expired in 2026. Which the North American Community Hub analysis projects will reduce enrollment in direct purchase insurance by 4.7 million enrollees, a 12.3% drop, with Florida, Texas, and California facing the sharpest fallout as residents who qualified for subsidies suddenly face significantly higher unsubsidized premiums. The long-term care numbers that end retirement finances. The most financially catastrophic healthcare cost in retirement is not hospital bills or prescription drugs. It is long-term care, and it is the category that the fewest retirement plans adequately account for. 7 out of 10 Americans will need long-term care at some point in their lives, according to federal health projections cited by Genworth's 2026 Cost of Care Survey. Every day until 2030, 10,000 baby boomers turn 65. The demand for long-term care is growing faster than the supply of facilities and workers trained to provide it, and the cost data for 2026 reflects that imbalance with clarity. The state-by-state variation in long-term care costs is larger than almost any other healthcare variable. In Alaska, a semi-private nursing home room costs $32,220 per month, according to SeniorLiving.org's February 2026 data. More than $386,000 per year for a single person. Connecticut carries the second highest nursing home costs in the country at approximately $14,600 per month for a private room, according to elder care cost data. Massachusetts is 39% more expensive than the national average for long-term care overall, according to Retire Guide analysis. Hawaii's assisted living costs average $12,000 per month, the highest in the country for that care level. And nursing homes in Hawaii are 56% more expensive than the national average. Minnesota has the most expensive in-home care costs of any state, running 34% above the national average. The retirement destinations that have been most aggressively marketed to Americans of Florida, Arizona, and the Carolinas present a more complicated long-term care picture than their tax advantages suggest. Florida's per beneficiary Medicare spending is among the highest in the nation. And while its nursing home costs are closer to the national median than those of the northeastern states, the combination of high utilization rates and insurance market disruption creates a total healthcare burden that retirement planning calculators systematically underestimate. At the national average nursing home cost of $9,342 per month, $250,000 in savings covers approximately 26 months before additional funding sources must be identified. In Connecticut or Massachusetts, that same $250,000 runs out in 17 to 18 months, the Medicaid cliff that most families hit too late. For the majority of Americans who have not purchased long-term care insurance, which was offered by only 19% of employers in recent surveys and purchased by far fewer retirees than financial planners recommend, the path to covering nursing home costs eventually leads to Medicaid. But the mechanics of Medicaid eligibility for long-term care involve a financial reality that destroys retirement savings with a speed that most families do not anticipate. Most states cap countable assets at $2,000 for a single Medicaid applicant for nursing home care according to 2026 Medicaid eligibility data. Meaning a retiree who has worked their entire life to accumulate savings must spend down to essentially nothing before the government will pay for their care. The 5-year look-back period means that asset transfers made in the 5 years before a Medicaid application are scrutinized and potentially penalized, preventing the financial planning maneuvers that might otherwise protect a surviving spouse or children. The states where long-term care costs are highest, Alaska, Connecticut, Massachusetts, Hawaii, and Minnesota, are the same states where the financial destruction of spending down to Medicaid eligibility is most total, because the combination of high costs and strict eligibility rules produces the fastest and most complete elimination of lifetime savings, where the numbers are actually manageable. The states that consistently rank among the most affordable for long-term care share a cost structure that makes the same retirement savings last dramatically longer. Louisiana is the most affordable state for long-term care in the country, with annual median costs 28% below the national average, according to Retire Guide analysis. Missouri has the most affordable private nursing homes and assisted living of any state, running 27% below the national average, with monthly nursing home costs in the range of $5,500 to $6,500 according to eldercare cost data. Alabama, Mississippi, and Arkansas all carry long-term care costs 22 to 23% below the national average, with Alabama's in-home care costs running 44% below Minnesota's, the most expensive in-home care state in the country. Oklahoma's private nursing home monthly cost of approximately $6,205 compares directly with Connecticut's $14,600 for the same care level, a difference of over $100,000 per year in the cost of identical services. Missouri's assisted living at $5,464 per month sits nearly $50,000 per year below Massachusetts at $9,610 monthly for comparable care. The retirement geography of healthcare cost in America is not a minor variable in retirement planning. It is one of the largest financial decisions a retiring household makes, and it is one that most financial advice treats as a footnote to the income tax calculation that drives the majority of retirement state decisions. The tax advantage that moves most retirement decisions is worth thousands of dollars per year. The healthcare cost difference between the most and least expensive states is worth hundreds of thousands over a retirement lifetime. Where you retire does not just change your tax bill, it determines how long your savings last when the expense that nobody plans for adequately finally arrives. Subscribe now, because next week we show you where the math actually works across every retirement cost category simultaneously.